beneath the
Dr.
surface,
Zoobah, right?
uncovering the hidden. So I'm very sorry that I could not make it there,
Dr.
but
Zoobah?
here's my video presentation on OSSN. Ocular surface squamous neoplasia is a spectrum of eye surface tumors that ranges from mild dysplasia to invasive squamous cell carcinoma, typically affecting the conjunctiva and cornea. The stem cell theory says that origin is from limbal transition zone. The risk factors include UV light exposure, HPV, infection, immunosuppression states, and xeroderma pigmentosa. The patient presented with complaint of diminution of vision in left eye. He was a 48 years old male and a white mask for 5 years. There is history of diabetes mellitus for 23 years and post-COVID-19 mucormycosis, for which he underwent bilateral maxillectomy 3 years ago. The vision in right eye was 6/6 and left eye was finger counting at half meter. NCT was 13 mmHg and unrecordable in the other eye. Conjunctiva was normal in both eye. Cornea was clear in right eye, and whereas left eye showed this. As we can see in the picture, there is this grayish white horizontal opaque band of 2 into 7 mm in size, which is spanning the pupillary area. It has an irregular surface. Anterior chamber was normal and coid. Pupillary reaction was normal size, normal reaction, and in left eye it was not visualized. Iris was normal color and pattern in both eyes, and lens was IMSC in both eyes. Fundus in right eye was within normal limit, and left eye showed hazy media with central fundus within normal limit. Impression cytology revealed full thickness squamous metaplastic cells with anisonucleosis. So we planned the patient for excision of mass with amniotic membrane grafting. Histopathology revealed non-keratinized stratified squamous epithelium with moderate to severe focal dysplasia and stroma, loose fibrocollagenous tissue with areas of hemorrhages and congested vessels. There was no breach in basement membrane, and they came to a diagnosis of OSSN SYN3. Patient was then advised an postoperative period as topical mitomycin C drops 0.04% for 3 cycles, 2 weeks on and 2 weeks off, with antibiotic and steroid. Postoperatively, patient gained a vision of 6/60 with a slight nebulocorneal haze at the operated site and a nasal fleshy mass. So the difference in this case was that it is a rare presentation of OSSN, which as we saw that it has occurred post mucormycosis, and when the patient underwent maxillectomy, it occurred after that, which is an unusual background for OSSN. And the normal OSSN lesions is usually nodular or gelatinous, whereas in this case it was horizontal grayish white lesion. In follow-up, there was no signs of recurrence. The case highlights early diagnosis and prompt intervention of a neoplastic lesion prior to sequelae. Clinical implication says that recurrence rate of OSSN after surgical excision can occur in about half of cases for 10 years. Rate of recurrence is substantially higher in setting with positive surgical margin. Invasive squamous cell carcinoma is also an entity which involves orbit, globe, and can invade to sclera. Thank you.